Yes,
Right.
Fergus.
Dan Eichenbaum
Yes.
mentioned the health savings accounts, and I'm just concerned about this whole idea of sort of tax deductions for medical care. And would you support a shift away from that, or basically having government define what is medical treatment? Because right now, some things are tax deductible and other things are not. And that seems to be the heart of the problem, which goes back to the Great Depression.
Okay. So the question was about health savings account and how does that work in terms of,
Well, the only reason for those is that people want to hold on to the tax write-off, and therefore we've got to have these health savings accounts because they're tax deductible or whatever. Why don't we just move away from this tax deduction altogether?
okay, health savings accounts in relation to tax deductions, Dr. Dent?
Well, to answer your question, first of all, obviously the 16th Amendment has been the enemy of freedom since 1913. So whenever you're talking about any programs in relation to taxation, it would be far better for all of us, for our freedom, if we did not have an income tax. As you well know, the income tax, for the first time, gave the federal government the opportunity to reach directly into your pocket and steal money directly. Before that, you paid taxes only to your state, and every year the federal government had to come begging to the state to get whatever money it needed, which gave the states an enormous amount of power. I don't view healthcare savings accounts, I don't look at them for their tax-saving purpose. I look at them as a way for individual people to own the ability to have their own health care and pay for their own health care. So for me, it's not primarily a tax-saving vehicle. It's a vehicle so they can put money aside for the day-to-day medical needs that they would need. If you had that kind of system, then a high-deductible catastrophic insurance policy, which would not be that expensive, would be affordable, as opposed to the way it is now. So you'd have a two-tier system. You'd have the healthcare savings account when you had a sore throat, or you wanted to buy medicine, or whatever. But if you got sick and ended up in the hospital and had to have a big operation, that's what the catastrophic insurance policy is for. Very similar to homeowners and automobile insurance. You have anything to add?
Yeah, I would not have it at all, because I want the government involved at all in it. So my whole thing is, I mean, optimally, I think that's maybe what Dr. Dan was talking as well, is what the system we have now, that's great. Now, what's interesting, in the Obamacare plan, the healthcare savings goes away, catastrophic plan insurance goes away, all those go away. See, the things that are beneficial within the structure we have today leave in 2014 and 2016. Because the ultimate goals are all on a nationalized one-payer system. That's the goal. I like what he talked about, the idea of slavery. And it does sound crazy when doctors are saying we're going to be slaves to the system. But the 13th Amendment is very clear on that. We will now be indentured servants to actually work at what the government says. Now, I went through the healthcare system. I actually read the plan. You know, I'm sure you did too. 3200 and 3950. There's a lot of empty spaces, believe it or not, within 2700 pages. Stain, the Human Health Services Secretary, will make decisions here, here, and here, and here. I'm a pro-life OBGYN. What happens if? What happens if I must do or refer for abortions? What happens? What happens if a certain a procedure that I know is beneficial is gray out? See, these are things that we're thinking about that as doctors we know it works best to the patient. But I'm still confused. Where in the heck is the government, after my tirade here for 30 minutes, of the government's position between my physician and me? And that's the part we're missing here, guys. But the healthcare savings, I'm thinking you're going to the whole idea, if there was no income tax, we would not need this kind of write-off. Am I correct?
Right, well, I'm being pressured into a house savings account through my employer. I just want the cash. I don't want to have to be involved with this. I do have major medical coverage, but I don't want to have some expenses associated with medical care as opposed to vitamins or nutrition or whatever it may be.
I think this gives a great articulation of Bastiat's last paragraph in 1850 in the law. He says we're not against healthcare, education, all these things. We're against the government run these things. And see, I mean, a laissez-faire free market enterprise would answer all this stuff because those markets would come. Those billion decisions a day would make this thing happen. But the elites don't believe that could occur. So I'd like to get rid of all government involvement and all healthcare and actually let us have that free market dictate.
Let me amplify one additional point that Greg brought up, and that involves being forced to do things that you don't want to do. there obviously, under Obamacare, is going to be a major shortage of medical personnel. The government does have plans to deal with that, and that plan involves, number one, allowing non-physicians a larger scope of activity. So in other words, you won't necessarily get care by doctors, you may get care by nurses or RNs or some lower level of or less trained individual. They also will open the door to foreign trained doctors to bring more of them in here. And the third thing, which is much more dangerous and much more insidious, is they want to nationalize medical licensure and then make participation in Obamacare a criterion for whether you get a license to practice medicine or not. That would go to what you were saying, namely that if they say you're going to perform this procedure, if you want a license, you got to perform that procedure, which essentially says the only way you can practice medicine is exactly the way those 15 people in the Department of Health and Human Services said you're going to practice.